go through the presentations of the panelists. So I myself, I am in Montreal, Quebec. I acknowledge that the place in which I work and live is situated within the traditional unceded lands of the Kanien'kehá:ka peoples, part of the Haudenosaunee Confederacy. There is also a strong historic presence of Anishinaabe peoples in what is now known as the Greater Montreal area. Tiago-Tiage, or Montreal, has also long been and continues to be a gathering place for many First Peoples from all directions. We honor and thank the traditional custodians of this land and strive to work for the success of future generations. So I already introduced myself. I will be moderating this session. And without further ado, we'll begin with introducing Charlene Ronquillo. Charlene, please introduce yourself.
Hello, everyone. Thank you for joining us today. We really appreciate a chance to kind of connect on a more interactive basis with you and hear directly from folks about your experiences and kind of start this discussion. My name is Charlene Ronquillo. I'm an assistant professor at UBC at Okanagan School of Nursing, and I'm joining you today from the land of the Syilx Okanagan. I'm just going to go along here, the list of other folks. I'll pass it on to Dr. Aisha Lofters to introduce herself.
Hi, everyone. It's a real pleasure to be here virtually with you this afternoon. My name is Aisha Lofters. I'm a family physician and a clinician scientist at the University of Toronto and Women's College Hospital. Happy to be here, and I will pass it now to Dr. Ali Ben Charif.
Hello, everyone. This is Ali Ben Charif. You can call me Ali. I am originally from Comoros Islands. It is a tiny country near Madagascar in Africa, but I studied in Senegal and in France before settling in Canada since 2016. I am a scientific consultant with international organizations such as WHO and Canadian University and Institutes. And my area of expertise is implementation science with a focus on scaling evidence-based innovation in primary care. Happy to discuss with you today. Thank you. Back to Jackie, I think.
Yes, and over to Jackie Hanson. I just have to make sure that you're unmuted here. So there we go.
We cannot hear you, Jackie.
Muted, Jackie.
Yeah, Jackie, we can't, you're still on mute.
There you
There
go.
you go.
Can you hear me now?
Yes.
Can you see me?
Yes.
Okay, I wasn't sure because all I can see is a picture down here. Anyways, my name is Jackie Hanson, and I've been working in participatory research with communities for now 24 years. And I hope to be an important part of this process. Thank you.
Thanks, everyone. Again, we're really excited for the interest on this topic. And now we're going to go into the session of session objectives. And I guess over to you, Charlene.
Sure, yeah.
Great.
Yeah, so we're going to try to keep it as advertised on our materials. So we've got 5 kind of objectives that we like to try to get to today. First is introducing or talking about some of the EDI definitions that you will see out there, the ways that these have been taken up in research. We're going to introduce, for those of you who may not yet be familiar, health equity impact assessments and explore some examples and see how those might be tools that might be useful for some research teams in terms of integrating or evaluating EDI components of their work. Learning about the role and the scope of the CPCRN EDI Working Group. So the group here, tell you a little bit about kind of our scope, what we do, what we don't do, and answer any questions you might have. Of course, hear from Jackie's very valuable experiences about, exemplars of what's worked well, what are areas that may we need to think about as researchers as we're involving patient partners in promoting EDI practices. And then the end part is where we get into the discussion, and we really hope to catalyze some thinking and reflection among the teams themselves about your own kind of EDI competencies, your level of comfort, capacities, and any gaps that there might be in your team. So we're going to kind of swap along amongst different people to talk about different parts of the slides here. Okay, so quickly, what is EDI definition? So there are quite a few floating around out there depending on kind of where you're looking. We'll focus on the tri-agencies here because that's likely going to be what most of the teams are going to be dealing with as you're applying for grant applications and kind of creating EDI plans. We chose to highlight the definition that's provided by the New Frontiers in Research Fund. I really personally see them as leading a lot of the kind of thoughtful work around EDI and how we think about it. And so you can see the link on the website, how they address or how they define what is equity, what is diversity and inclusion. And for those who may be unfamiliar, these really center around, removing systemic barriers, ensuring representation of different perspectives, and ensuring belonging and inclusion as part of the research process. And so the way kind of we've taken up or have so far kind of talked about EDI in the context of the CPCRN are like a variation of those definitions, right? So equity, thinking about creating equal opportunities for all members, doing our best to eliminate barriers like discrimination and bias, diversity as recognizing and celebrating and acknowledging the need for differences and the richness that brings to the work that we do, and inclusion to ensure that all CPCRN members feel valued, integrated, and respected for their contributions, and all are equally or equitably supported. This is worth highlighting. I've gone to quite a few other EDI in research talks recently, and one of the things that we're starting to see, or we are seeing from the Tri-Council, is this distinction between integrating EDI as part of the research process. So how do you integrate it in your kind of your recruitment, your analyses, the way that you're actually doing the research. And then there's EDI considerations for the research teams themselves. So how are you building capacity to promote, inclusion of different perspectives? And so those are two components of EDI that we need to think about as researchers. Again, it depends on which agencies you're applying to, how much they're emphasizing one over the other, and how much you need to be explicit about, kind of how you're tackling each of those components. And again, I point to the Tri-Council websites because they do have like really extensive resources in terms of how these specifically need to be addressed depending on the competition and depending on the granting agency. So I'm going to pass it over to Ali now.
Thank you. Here I would like to share my experience as a reviewer with the New Frontiers Research Fund. This year we noticed that applicants describe the EDI plans in a generic way based on those of their institutions or universities. It all seems theoretical, and that's exactly the point. So we think our network must identify concrete practices for addressing systemic barriers in our research environment. And so the IED objectives need to be SMART, S-M-E-R-T, that is specific, measurable, aligned with the wanted outcome, realist, and timely. It is also important to note that a diverse group is not always inclusive, but the reverse is always true. So we need an EDI plan that outlines objectives and includes action items based on the needs and challenges of all members. So that is all. Thank you. Back to you, Charlie.
Thanks, Ali. And I just want to share a bit too, like speaking to teams, we often get a lot of the same questions around how do I develop an EDI plan? Is there a checklist, for example? That's a really common question to make sure that we address everything. And I think one of the things that we've been talking so far as the CPCRN EDI Working Group is the need to to do it in a meaningful way, to think about it in the context of the specific projects and the specific teams. So for folks who are, very comfortable and familiar with doing EDI work, this probably sounds like a lot of repetition, but to Ali's examples, it's easy to write kind of generic theoretical EDI plans, but to make it really fit, to demonstrate that it's thought about in a meaningful way really needs to show that, like the teams themselves are familiar with the specific EDI gaps in that, whatever, that health problem, that clinical problem, that population, and make it fit within those contexts. And we'll get to those bits in the discussion. I'll pass it on to Aisha now.
Thanks, Charlene. So as Charlene mentioned earlier in the slides, one of the elements of EDI work is thinking about EDI considerations in the research process. And when we're doing that, one of the systematic ways that we can approach that is by using what's called HIAs, or Health Equity Impact Assessments, which some of you may have heard of. What is a HIA? It's a decision support tool, and it's a way to walk users systematically through the steps of identifying how a research project, a clinical program, a government policy, or something similar will impact population groups in different ways, specifically in the context of EDI and potential structural marginalization. So it actually can help us to identify any unintended potential negative impacts and determine ways to eliminate them. And on the flip side, can help us to identify potential positive impacts and ways to implement them. To the point that Charlene just made, it's not about quickly running through a document and taking a tick box approach. It's really about developing more equitable delivery of care, policy, services, and programs. Go to the next slide. I'll just quickly share a few examples. You'll see that they're all quite similar. This is an example of a HIA from Public Health England. And as you can see, it's just a way to work through for an initiative, thinking about what are the inequalities that exist in relation to your work. And this might involve, thinking about what do we already know from the literature? What do we know from frontline experience? What do we know about the social determinants of health in our particular context? Starting to think through what those inequalities are. And then, like I said before, thinking about how your particular work might affect health inequalities, both positively or negatively. Go to the next slide. This is another example of a HIA from the Canadian Public Health Association. You'll see it similarly structured, thinking about unintended positive and negative impacts. Also calling us to think about specifically who might be impacted. Often we talk, quite frankly, in vague language about marginalized groups or equity deserving groups. And sometimes that term is appropriate, but to really have an impact, we need to get very specific. And again, think about in our context for our research question, who are the specific groups who might be impacted? Also thinking through where might we need to gather more information and think about how you'll go about gathering that information. Next slide. And here's another example of a HIA from where I'm based in Ontario, from the Ontario Ministry of Health. Again, really calling us to think through who are the groups, what are the potential impacts? And also this one has a step 5 around dissemination. So importantly, and this is good for us to think about as a network, how can we share what we've learned once we've had some important learnings? Next slide. Now, with doing a HIA, no matter I think which particular tool it is that we use, it's really important to think about how we will engage and partner with patients and communities for this health equity work. Often we get behind closed doors and do this work without including those who are most directly affected. So when it comes to HIAs, I'd push us all to really read and reflect on who are the impacted communities, as I said before, and then think about how can we best, if we don't already have those connections, establish meaningful and sustainable connections with community partners to do this work. One example that I could highlight at Women's College Hospital, one of my colleagues, her name's Ambreen Sayani, has co-led a table called MPACT, which is a patient panel. So it's actually a group of 15 to 20 patients who themselves all have lived experience of social marginalization. and they actually provide consultation and they do a HIA, because when it comes to health equity and EDI, I argue that there's no more valuable experience than that of lived experience. So it's easy, I think, for those in ivory towers in the academic world to speculate on what the inequities could be, but there are people who have directly lived it, and we need to really hear from them and center their voices. The other point I'll make about health equity impact assessments is that it's not a one-time thing. So we don't just do it at the beginning of a project and then, file that document away. We really should be taking a continuous quality improvement approach so that we're constantly coming back and checking in again, as the program has progressed, as our research has progressed, what have been the unintended negative and positive potential impacts. Next slide. So along those lines, we did want to talk a little bit about what we are thinking it is that the EDI Working Group will do and what it is that we won't do. I think for one, there's the idea of resource guidance. So we are going to be working to compile resources, so to put together tools like this HIA, but also tools around capacity building on research teams, documents like what was highlighted from the NFRF, and being able to share those with a network broadly about tools that we think really show us and exemplify for us how EDI work can be done in a thoughtful and meaningful manner. We also want to be here for consultation, discussion, brainstorming, when people are thinking about their efforts with EDI, thinking about their evaluation plans. But what we're not going to do is to do it on behalf of teams or do it for teams. To really do this work in a meaningful way will require the teams to really delve into it. We know it's brand new for some people and we're here to support in that regard, but it's really got to be led with a deep engagement of the teams themselves. Charlene, anything you wanted to add on that front?
Yeah, and I think part of kind of the reason we've kind of spoken a lot about, beyond kind of obviously capacity. So you can see this a smaller team that we're going to be working across the network. But beyond that, I think part of the, challenge we presented to the network of putting the onus of thinking about EDI work in the context of kind of individual teams and individual projects is like, it's not possible for the three of us to have that kind of deep substantive knowledge about each of your research areas, right? And if we're talking about kind of that matching of, understanding where the inequities lie, which populations or which individuals are most affected, it is really the teams who are embedded in the research and are working, ideally with patient partners and community partners who are going to know the most about kind of where those are. Like, we could talk broadly. Again, we could probably talk about kind of those vague theoretical inequities for groups, as Ali has mentioned, that a lot, the approach that a lot of teams tend to take. But I think we would actually be doing a lot of people disservice if we were the ones to take on that work, just because we don't have that kind of embedded knowledge. Was there anything you wanted to add, Ali, before we hand off to Jackie?
No, it's okay for me.
That's good.
Hello.
We'll pass it over to you, Jackie.
Hi. I'll just make sure that you guys can hear me. Can you hear me?
Yeah.
Yes.
Okay. So I'll just talk a little bit about my journey with the working with communities. Speaking from that experience, I was invited in 1998 to participate in a community building of surveys. And at the time, I didn't really know what that was. But we gathered together about once a week, shared our stories, talked about what this might look like. We went through many different venues building this survey for the 5 core communities in Saskatoon to help build health programs. So this actually took quite a few months of meeting together. And then we went out and before we went out, we actually established our values and how we were going to work with one another and then work with communities. And I would say those were some of the most positive things that happened in building our group. and also building beyond the group. So with communities and with the university as well. And one of the things that was decided that the information that we gathered would actually belong to the community and not just to the university. So the information that was gathered was both owned by the community and the university, and the information gathered couldn't be shared unless permission was given from both. So this was one of the things, these were some of the positive things that came from that. And also sharing stories, like we shared many, many stories. And this was one of the challenges of doing research, because at that time, data didn't process stories, or they didn't know how to do it, I guess. But we kept getting and gathering our stories, and eventually the way data was gathered was changed. So now stories are or can be included in the research. And really, if I was to talk about anything that was a negative experience as far as the journey, I think it's always about changing for the better, for the positives. Sometimes we were in opposition of research methods that were practiced, and we were bringing in new ways of doing research, which can sometimes be challenging is the best way to say, or an opportunity to grow. So that is some of the things that I've experienced over time as far as building programs and working with communities. And I think some of the things that we did are actually were life-changing for those communities. So if you guys have any questions you'd like to ask me, I'd be happy to answer.
I'm just watching if there's any hands, but if I, thanks for sharing your experiences, Jackie. And I think one of the things that stood up for me as you were speaking is, you know, part of the, thinking about the inclusion piece of EDI. And I think part of the challenges for, you know, those of us who might be used to working within, you know, like we're trained a certain way to do things, kind of a specific way, kind of whatever, the same way every time. But I think a part of the commitment, if we do want to meaningfully be inclusive, is being open to those challenges. So I appreciate you sharing the example of, you know, challenging methodologies. And sometimes that's not something that the team's necessarily happy about. But it depends, you know, you could look at it as a challenge, or you can look at it as an opportunity to evolve. But I think thinking about like having that as one of the foundational reflection points of your team, you know, which bits can we flex on, which bits can we not? Because one of the things that unfortunately you do see sometimes is, you know, patient partners, communities are involved, ask for their feedback, but then the teams don't follow through or use that feedback. And so it becomes this kind of really tokenistic exercise. So I think just reflecting and being realistic within your teams about, you know, these are actually things that we can't budge, that transparency, just I think for the most part, when we're working with patient partners, you know, like people are fairly reasonable and we can kind of work out a plan. Usually they'll say, okay, you know, like this is something that has to be this particular way, but could we shift somewhere else? But I think just kind of being honest within our teams about what are we going to do with the engagement? What are we going to do with the information? How and how that shapes inclusivity, I think is a really important part of the process. I don't know, Aisha. Go ahead, Jackie. Yeah.
And I think that's why we had those meetings and those discussions in the beginning, so we could establish those values together, because those values transcended over into how we would deal with the university. how we would deal with people, how we would deal with situations that came up that may be dangerous, or, you know, we just didn't know at the time, but we were discussing those things and working out those little details and what we would share and who would be responsible for what. And it really does come down to having those discussions around values and then going on from there to decide what will work and what won't work, and what can we do and what can't we do within the context of what research methodology we're dealing with. And this kind of research that we did was quite unique. And that's actually probably why I've always stayed involved, is because I was just, well, not just, but I stayed at home. I was a stay-at-home mom, and the university provided an opportunity for me to grow and learn and see what the other side of the world looks like. So it was quite interesting. Yeah, quite the journey. Still here.
Thanks, Jackie. I don't know, Ali or Aisha, if you want to add or comment on anything before we go on.
Just one thing I want to quickly comment on is just that in listening to the both of you speak and reflecting on my experiences, that I think communication is key. And I think from that, honesty and trust and relationship building is key. So again, this can't be the kind of thing that you rush to find a patient partner and get them to write you a letter of support, and then that's kind of the end of it. It really, I think, is about relationship building, having conversations. You know, what do you want to accomplish? What do I want to accomplish? How can we work together? So that when those inevitable roadblocks or issues come up, there's already an established trust there, so that you're able to work through it, or to understand, you know, these are the bounds that I'm tied to because of my institutional requirements, but know that we're still working towards the same goals. But again, it can't be something that's just kind of rushed through or done in a very quick and piecemeal manner.
I think it's time to hear from others because as you say, the important part is to know what is the challenges Mamba faced, or the need, because this is what will guide this AD plan. So I think it's time to hear from them.
Thanks, Ali. So we have several questions for open discussion, but before we jump into that, we just wanted to check in and see if there's any kind of burning questions or clarifications folks needed. I know we didn't spend too much time on definitions, and part of that was deliberate choice because there's a lot of that information is already out there, so we pointed to those links. But were there questions about what's been talked about so far?
So in terms of the questions or the discussion section, I just wanted to mention really briefly that feel free to type in any of your comments or questions within the chat, and we'll try to moderate those the best we can there. Along with, feel free to also raise your hand if you would like to be called upon, and we'll call you to, and then you could unmute and ask your question, etc. So thanks.
Thanks, Jamie. I don't see questions so far, so we're going to move into this discussion consultation, and the purpose of this is really to understand where people are at, where support might be needed, and kind of just try to get a gauge of where network members feel like support could be needed, what that could look like, and that kind of thing. So we created a series of questions, and please feel free to kind of raise your hand or type into the chat to respond. So the first one, again, encouraging people to think about kind of your specific research problems, your research area, the phenomenon of interest, common barriers to meaningful EDI related to the work that you're doing. If folks would be willing to share that and what those look like.
Perhaps you can invite some people to share their thoughts.
I see there's a comment in the chat from Lori, stating, I would say a barrier being in health research world where EDI is not necessarily standard in practice. Could you share a little bit more, Lori, about kind of what is, I guess, the standard currently that you see?
Hi there. Anya and I are calling from UPI. We've got some of our other coworkers on the call too. Thank you for this. This is really wonderful. I guess, you know, we have started an EDI kind of group amongst our staff, kind of on our own, seeing that there are gaps in processes and just the need to do more, even if it's not, you know, expected of us. So we're kind of starting to navigate that and finding that maybe some of the barriers being that as we go through certain processes, whether it be like the REB process or program planning or anything, it's like, it's just not expected, I would say, in the general health world that we're kind of supposed to be going above and beyond. So we're trying to really think of these things, I would say, like on our own in a way. I don't know if that makes sense, but maybe feeling a little bit more like in silo for certain things or considerations as we kind of go forward in whatever kind of health research we do. So whether it be like, you know, programs going forward with that, or curriculum that we're developing. And I won't put anyone else on my team on the spot, but I know a couple of them are on here as well. Maybe they have something to add, but that's just kind of, you know, what I've noticed. Speak on behalf of Anya and I, who are here in the office together. And yeah, just kind of seeing that maybe the health research world is not quite up to standard with kind of practicing those EDI principles to full capacity, and even just the knowledge and education, you know, of maybe like people around us, kind of, I feel like is a little bit of an uphill battle at times. And it's just maybe a little bit slow for uptake in terms of getting everybody on the same page. I don't know if that'll make sense to everyone, but that's just kind of what I would say I'm finding as our group kind of goes forward. But maybe some others from UPEI have something to add as well. I'll just kind of leave it there.
Thanks so much, Lori. I don't know, Aisha or Ali or Jackie, if you wanted to respond.
I would just comment that I sympathize. I think many of us who work in the area of EDI do. Things are starting to get better, definitely, but I think we really do need that shift from EDI being seen as, you know, a soft, one of the soft methods, or a nice to have, but it kind of gets tossed when resources are tight or work that people are doing off the side of their desk, which honestly is often how EDI work has been done in the past and still is being done. I think we are starting to see shifts in that, but I think really we need leadership. I think once senior leaders recognize the importance of EDI and really make it part of the culture and part of the infrastructure, that's what's needed for meaningful change to happen. I certainly think within the realms of the network, it's great to see that EDI has been given consideration and that we do have a working group and that we're encouraging everybody to think about it within the network. But I do think that in general, the shift is coming, but we've got to do what we can to push harder just to make it really coming from leadership, just a recognition of the importance of EDI.
Thank you so much for that. That was, yeah, that's great.
And also we understand, because I don't know if you introduce yourself, but we know the challenge of this. We are a network across Canada. So we understand that some institutions have their own, you know, EDI plan, which is why the network allowed every team to have at least some, you know, some specific item or area for this kind of to take account of the EDI consideration everywhere. So this is why it's important to hear from everyone outside from Quebec, from Ontario, from what they face as a difficulty or challenge, and how they see them in the network, or how the network can help in addressing those kind of challenges.
As folks are speaking, it's making me think about as well, you know, this question of how to make it not an add-on and not viewed as a nice to have and convincing leadership. And I think one of the kind of broader gaps is making that link between EDI and health outcomes and those inequitable health outcomes. And I think as a research network, you know, some things that we might want to think about is having maybe, like, it's not your main research question, but starting to build the evidence around like that EDI does have downstream impacts, like that those efforts do have downstream impacts for different groups of people, right? Like, embarrassingly, we're still just acknowledging sex and gender differences in outcomes in health for so many fields. And so I don't know, that's my personal thought, but just kind of being able to link kind of concretely that the different ways we do things for different people do end up with different outcomes. And maybe that's one way we can start to, again, generate evidence and build this kind of convincing of health leaders to see it as not just a nice to have kind of thing. Mindful of the time, I'm going to go on to the next question. Thanks so much for sharing, Lori and Anya. And so for those who have engaged with the process, what is your typical process like when assessing EDI needs and goals, when you're planning a study, writing up a grant, that kind of thing? Go ahead, Kate.
Hi there, I'm another representative from the UPEI team. So as Lori mentioned, we have our own sort of internal EDI committee, and what we've sort of started to do is bounce ideas. So when we put together an REP proposal or data collection forms and that kind of thing, we sort of have a very informal process that we've put together of bouncing it around to each other to just try and make sure that there's some EDI perspectives going into it. But I do like to see these other tools that we can sort of implement into that as well, like you mentioned earlier.
Yeah, I was going to comment, Kate, that it sounds almost like you're doing a bit of an informal health equity impact assessment just by having colleagues, again, that can see things from a different perspective or see things that perhaps you might not have thought of from the EDI perspective. So that's great. I see Lori.
Me again. I just wanted to add, Anya had we were just kind of chatting here, and Anya kind of mentioned, you know, like when she's developing like curriculum, it's kind of like applying this lens, and then you just hope for the best that you're meeting the principles, because there's really no like formal process, like Kate was saying, and I guess like, you know, we're trying to do that and kind of establish like what we can be and how useful we can be. And we really do want to be kind of like promote that leadership and showing people that we work with, like this has to be more standardized, or it has to be the standard and foundational. And, you know, I'm speaking, I have 2 dietetic interns on the line too, that's with us as well with our network. So they've already kind of, you know, gotten a little rundown yesterday about how we're trying to kind of approach this and using all of these different principles. But yeah, like the process is tough because we don't always know if we're doing it right. And I'm a dietitian, and I'm part of a national association, and actually we have an EDI committee with that as well. So we actually did take a HIA tool that we had developed or adapted. It looks similar to some of the ones that you were showing. So that's kind of where we were jumping off from, was implementing or using this tool. So it's really good to see, because I actually hadn't seen other HIA tools, and I actually didn't know, maybe naively, that it was like very utilized term. So that was great to see. And there might be some other things that might be a better fit for us because the tool that we were using is like primary care focused. Maybe it is acceptable. So it was great to see some of those examples, and I've bookmarked those for sure. But this is like incredibly helpful. So many things you're saying. I feel like it's like a lot of UPEI here. We have like quite a few UPEI people on this call, so it's great. So hopefully I'm not taking up other people's time here. So I'll go on mute.
Thanks, Lori. And just to quickly comment that it would be great as things progress offline, even if you're able to share that tool and see if it could be useful for others as well.
Yeah,
absolutely, for sure.
Another comment would be because I would like to know that the existing tools seems aligned with what you want, because sometimes you say, okay, there is nothing that we can use that, but there is something at least that we can adapt it. Do you, some of you have this kind of reflection that adapting some to the specific needs? Think no comment. So yeah, but I just say that because, you know, we, as I say, we are several provinces, and some of province are, you know, English province, French province. They can be those who work with mostly with indigenous people, First Nation, and other work. So depending on the area or on the subject, perhaps there will be need to variate it. The tool could be, one could be fit to another. But have standard one for all, I don't think. But I don't know, just to have some thought about it.
Thanks, Ali. And I just I wanted to state really appreciating your team for sharing your experiences with us and kind of what that sounds like. And I think as you're speaking, it's making me think about, you know, like we're posing these questions to people and people might be hesitant, and just to provide some reassurance that I at least in my experience of speaking with people about their EDI plans and things like that, that the hesitancy is really common. Like I think we're all like quite afraid to do it wrong, to do it, to say the wrong thing or do the wrong thing or offend someone. But I think the question is, you know, like bringing that back to us, like, is that becoming then a barrier for us to doing the work? Because it's easier, it's comfortable to do things how we've always done it. And this work is challenging and we can get things wrong. But you know, one thing I've personally found helpful in doing this work is just like approaching it with humility and saying, no, I don't know everything. I'm going to do the best I can with what I have right now, the information I have right now, involve, you know, the people who would be affected as much as possible. Like to Aisha's point, you know, the people who actually would be experiencing things, because they can tell us kind of directly and firsthand about what that would be like. But I think just to say that it's really common for people, like it's a continuum, kind of how comfortable we are and how much experience we have. And it's okay to be, you know, wherever you are in that continuum. And that like there's no shame in that we're learning, because as mentioned, like systems aren't built to support this work yet. And so that is part of why I think so many of us are struggling. But I'll stop. I think Ali, you've got something to add.
I will have one question perhaps to Jenny and those participants who are mostly involved in this kind of network or association like Lori. Just to know if there is a way to collect data about the needs of team across the network, you know, because perhaps we have some common need and other which is specific, but we don't know right now if we don't have data about it. I don't know if there is a way, or some people have already done this kind of work, and how it could be done to make this work.
Yeah, one comment I would say from Lori that really kind of stuck out to me was, you know, how do you measure success in EDI? You know, and that's a really good point because it would help with planning, right? If you know how to measure success, if you know what the EDI needs are. So I would just say that I am meeting regularly with the other sport directors, and we're in the process. We have a working group that we're focusing on developing common indicators. So measuring success in building capacity and KTE, knowledge translation and exchange, but also EDI. And so this is something that we recognize as a real sort of gap at the moment. And it's something that I think will help teams and jurisdictions to plan their, you know, their EDI needs. But to answer your question as well, Ali, I think, you know, we wanted to, since this is a bit new territory for us, we really wanted to kind of focus on something that's feasible for us as a network. And that's why we chose, you know, to focus on our research projects and, you know, the kind of bespoke EDI plans for each research project, and allow them to be able to develop their own plans. So it's not tokenistic and all of those things. So, but in that process, maybe some things will really be, we can extract certain common things that all of those research projects potentially, and really then how can the network support them in that process. So I think this will be very key for us. It's something that we haven't done in the past for our research projects, and it might be really beneficial to kind of get a little bit more information from how the network can support in this very important space. So yeah, there's a lot to unpack there, and I think this is why we're, you know, having this consultative session to really get more feedback from people and how the network can really support research projects and PBRLNs, practice-based research and learning networks as well.
Which I'm just mindful of the time. I'm going to just jump to this last question, which we might be able to get some initial ideas of, thinking specifically about the role this network can potentially play. Like, we just wanted to hear what folks might have in mind in terms of how we can support, you know, thinking about if you're an early career researcher or, you know, somebody just new to engaging with EDI work, thinking about the barriers that you face, that you have faced in the past. So this is more, I guess, like around capacity building. So how do we build diversity in primary care research capacity? And what role can the network play? What kind of things might we be able to do to help mitigate some of these barriers?
So I'll just jump in to clarify. I don't know for all the folks that are on the call. The first question is really an objective, one of our 7 objectives of the CPCRN. So what are the barriers for early career researchers, you know, in disadvantaged groups to develop a career in primary care research? And in order to do that, we had some ideas about, you know, and we would like to hear from you if you have any ideas about this, and specifically what role can CPCRN play to overcome these barriers, but also, you know, facilitate or nurture on the positive side as well. You know, what are the ways that we can nurture and facilitate people in these groups to have a career in primary care research? And yes, Charlene, in other words, how do we get more diverse and inclusive cadre of researchers in primary care? That's a nicely worded question.
And this is the part because it's, for example, about recruitment. And we saw a lot that the fact that we allowed team to go with their flow, because they should be aligned with their university, we understand, and their center. This is why it's going this way, because perhaps the policy in UBC is different from McGill, is different from another. So have allowed the team to recruit as they are is a good fit. But the other thing is the problem is still the same most of the time. Is theoretical. We go in the website of every institution, you will see those roles. We recruit people from deserve people, etc., etc. But in practice, I don't know if it's true. This is the whole problem in EDI. So everyone write this in the website, in the ground, but doing that, there is a little people or less people who do that. This is why we don't have more tools of evaluation or more practical, more strategies for the practices. So how we can make this work in general is the idea.
Just I don't have an answer for you, Ali, but just kind of adding, one of the things that we talk about as we're developing EDI plans too is, you say as you write these proposals, for example, that, we're going to recruit, we're going to reach out to, I don't know, underrepresented groups to try to recruit people. But as you're writing that, you kind of already know, you also are supposed to know which student you are recruiting. So you're not actually going to be reaching out to those groups because you already are supposed to have a named person. And so there's this disconnect between, what they're asking us to do versus, well, they're like asking us to do kind of opposite things in a little ways. I'll stop speaking just to let Lori and Anya go, but yeah.
Hi, everyone. It's Anya and Lori. I guess like just a role that CPCRN can play, I figured is we do have the management meetings monthly. So I didn't know if it could always just be like a line item in the agenda of like, what are some EDI challenges that your organization is currently going through? So we can all kind of take 10 minutes to chime in and help each other. Sometimes having that like overarching, like kind of Lori and Kate had said, we're just starting out and trying to like piece everything together, but having an overarching kind of support, like to be able to kind of bounce back like feedback from each other between different provinces and see how they approach certain situations would be kind of helpful. So just another, like just a way to overcome these barriers. I was just thinking.
I guess I could add something too, just as a perspective of being a dietitian. I'm a staff at the network that we're at, so I don't even know if I consider myself a researcher, but so I feel like I help support, Ahmed and Kate who are on the call to do research and other projects we have. But I know like my profession and the perspective being that dietetics is like a overwhelmingly white female. And that's a huge barrier within my own profession that we're trying to overcome. And I don't know if you're talking about in terms of like nurturing diversity, all the way through being a student and giving, equal or not equitable opportunities and just opportunities to everyone that comes through to ensure that there is that representation of the true population, which, coming into research from primary care, I don't necessarily like see that a lot, even though like our network is very diverse at UPEI. We're very fortunate. And I think that's what really spawned on us pushing forward with these things, is because we all bring a different perspective to the table in terms of our own backgrounds. And so, but I don't think that's the case for maybe other places. So it's kind of, we were fortunate in terms of who we had at the table, and our boss is really good for ensuring that people have equitable opportunity. And we have a lot of students that come through our network with very diverse backgrounds. So we're definitely not homogenous here, so I think that helps. But like Anya said, I think just even like a check-in and support in that way, because, maybe if we have like larger questions, we're not sure how to navigate certain things. Like, I feel like this group would be really amazing and helpful to kind of help us even like troubleshoot, or like you said, guide, like, and educate ourselves. And, like everyone says, it's like, you don't ever, know it all, and we're all learning, and we're here to support each other. But I really like the feel of this group, and this is my first opportunity to be on something like this. So this is great. Yeah, just our reflections, I would say for sure.
I like this comment because this is the truth. We are all learning, and I like the way even it starts with this network, because I think it's one of the rare who are doing this, to go to consult member, to know what can be done, because the challenge we are facing, there is several teams. Some of the team are this small group, 3 person, 2 person, how they can, they don't think about EDI, this kind of group, but there is this other group, which is a large, there is a lot of people. Sometimes also they think because they have diverse people, it's mean they already take account EDI, which is not true, because EDI not implies inclusion, but inclusion implies diversity. So sometimes this is the, we say piège in French. I don't know how to say pitfall or something like that. So this is the danger for some of the team. So for example, some team, they think, okay, they live in the research, especially, we are not good in resolving conflict. Some student problem, you just leave it for a weekend, and the students still have this kind of problem living with this in his own, and become difficult. I just read from Jackie, who say that he's happy that he's helping for communication, for financing, transporting. It's kind of, even because we don't realize that sometimes patients don't even know technology, or they don't use it, or they need it to be even in this meeting, how to connect them to join the meeting, to do this kind of small thing that even we don't think. So they know everything. I will let her explain what she means about it, but I'm happy to hearing from Lori, this témoignage, as you say.
Thanks to everyone for a really fruitful discussion today. I think this has all been wonderful. Wonderful feedback in terms of the future direction of this, of our EDI activities and potential deliverables, etc. We're a little bit over, so I'm just going to, I think we will end it at this point. There is an email address there that you can feel free to reach out if you have some questions. That's our general admin email address for our network. And our next session is on June 20th, the same time, noon Eastern Standard. And this session will be focused on scalability resources associated with one of our Picky Network projects that we had in the previous iteration. So looking forward to that as well. And yes, so please complete our evaluation as well. And I'll let you go without further ado. Take care. Have a great day. Bye-bye.